Today, let us talk on the topic titled The Silent Epidemic of Migraine: Understanding, Preventing, and Healing the Modern Brain. Based on latest neuroscience, integrative medicine, and real-life healing experiences. Today, migraine is not just a headache. It is a message, a cry from the brain, the body, and the mind, saying, "I am overloaded." From high school students to working professionals and even elders, migraines have become one of the most disabling conditions of modern times. People move from one doctor to another, from one hospital to another, even outside the state, hoping for relief. They undergo MRI, CT, blood tests, and every possible investigation. Yet everything comes normal, and that's where frustration begins. So today, let us understand why migraines are increasing, why conventional treatments often fail, and how we can prevent and heal them, naturally, scientifically, and holistically. Part 1. What is migraine? The modern understanding. Migraine is not a simple vascular headache as we once believed. It is a neuroelectrical and neuroinflammatory event involving brain energy metabolism, sensory overload, and emotional circuitry. 1. The science in simple terms. In migraine, the brain experiences cortical spreading depression, CSD, a wave of hyperexcitability followed by a silent phase. This causes release of inflammatory molecules like CGRP, calcitonin gene-related peptide. Blood vessels, nerves, and pain pathways in the trigeminal system become hypersensitive. The result? Throbbing pain, nausea, visual aura, light and sound sensitivity, fatigue. 2. The trigger spectrum: stress and anxiety, sleep disturbance, skipping meals or dehydration, excess screen time, especially at night, strong smells, bright light, or loud sounds, hormonal fluctuations in girls and women. Processed foods, caffeine, MSG, preservatives, electromagnetic overload, Wi-Fi, phones, nutrient deficiencies, magnesium, B2, CoQ10. RT. 2. Why migraine is increasing rapidly. 1. Neurological overload of the modern world. Our brains were never designed for continuous sensory bombardment. Screens, notifications, bright LEDs, synthetic sounds, all overstimulate the visual and auditory cortex. The result is constant hyperactivation of the sympathetic nervous system. 2. Emotional pressure and anxiety. Epidemic. Students, especially in high school and college, face immense performance pressure. Emotional suppression, unresolved grief, loneliness, and fear manifest through the head region, often as migraine or tension headache. The brain and the heart become disconnected, a loss of coherence. 3. Invisible environmental stressors. Electromagnetic fields, EMFs, alter neuronal ion channels. Chemical fragrances and air pollution inflame the sinuses and cranial nerves. Poor nutrition weakens the mitochondria, the brain's energy factories. A 54-year-old lady had been suffering from severe migraine headaches and persistent sleeplessness since 2017. The pain was unbearable, often accompanied by vomiting, and the chronic sleep deprivation left her completely exhausted. She struggled to focus on her daily activities and gradually lost her quality of life. Over the years, she consulted numerous physicians, neurologists, and psychiatrists, undergoing extensive investigations including MRI, CT scan, and several laboratory tests, all of which showed no abnormal findings. Conventional treatment journey. She was prescribed multiple medications, analgesics, sedatives, and psychiatric drugs. Initially, she experienced temporary relief, but as time went on, the effect of the medicines diminished. The dosages had to be increased to achieve the same result, and eventually she developed significant side effects, forcing her to discontinue the drugs. In her desperation, she sought treatment in other states as well, hoping for a cure, but her condition remained unchanged. By this time, her insomnia, migraine pain, and mental fatigue had driven her into a state of hopelessness and suicidal thoughts. Turning point. At this critical stage, one of her well-wishers advised her to visit the Holistic Wellness Foundation, IMFAL, where natural and energy-based therapies are practiced, completely without allopathic medications. On her very first visit, she was treated with a combination of pulsed electromagnetic field therapy, PEMF, repetitive transcranial magnetic stimulation, rTMS, hydrogen therapy. That night, something remarkable happened. For the first time in 6 to 7 years, she slept peacefully for 1 full hour. It rekindled her faith and hope in recovery. Progress and recovery. Encouraged by the improvement, she continued regular therapy sessions. Gradually, her sleep duration increased, her migraine intensity decreased, and her mental clarity returned. Later, additional therapies like bioresonance therapy and occasional Vielight photobiomodulation were introduced to enhance her brain energy and neural balance. Within weeks, the transformation was evident. Her sleep normalized, headaches disappeared, and her energy levels were restored. Outcome. After a complete course of energy-based holistic therapies, she is now free from migraine, insomnia, and all associated symptoms. Without any allopathic medication, she has returned to her normal daily routine, emotionally balanced and physically healthy. Reflection. This case illustrates how chronic neurological and psychosomatic conditions, resistant to conventional approaches, can respond dramatically when cellular energy, brain coherence, and biofield harmony are restored. The integration of PEMF, rTMS, hydrogen, bioresonance, and Vielight therapies provided multidimensional healing, addressing not just the symptoms, but the root cause of dysregulation within the brain and energy system. 4. The medication paradox. Repeated use of painkillers leads to rebound headaches. Drugs like triptans may abort an attack but do not heal the underlying brain dysregulation. When the real causes, sleep, nutrition, emotional state, environment, are unaddressed, migraine persists. Part 3. The hidden dimensions of migraine. 1. Brain-gut connection. Over 90% of serotonin is made in the gut. A disturbed microbiome, inflammation, vagus nerve imbalance, migraine flare, antibiotic overuse, junk food, and irregular eating disrupt this delicate network. 2. The mitochondrial link. Studies by Dr. Alexander Mauskop and others show that migraine brains are energy deprived, low ATP in neurons. Now hyperreactive and fatigued brain cells. Magnesium, CoQ10, riboflavin, and L-carnitine are critical here. 3. Emotional and energetic imbalance. Emotionally, migraine represents tension between control and surrender, between mind and body. Energetically, it often corresponds to blockage in the head-neck energy channel, ajna and crown chakras. Techniques like heart-brain coherence, meditation, and energy balancing can restore flow. Part 4. Integrative healing and home care. This is where modern science meets ancient wisdom, and the clinical experience validates it beautifully. 1. Lifestyle foundation. Maintain fixed sleep-wake rhythm. Sleep before 10:30 p.m. Hydrate with clean mineral water, not soft drinks. Avoid skipping meals. Eat slowly and mindfully. Use anti-inflammatory diet. Green leafy vegetables, omega-3s, turmeric, magnesium-rich foods. Practice screen hygiene. Limit blue light exposure at night. 2. Stress and emotional reset. Heart-brain coherence breathing. Heart math method. Slow inhale, 5S. Exhale, 5S. Focus on gratitude. Meditation or prayer for 10 minutes daily. Journaling or creative expression to release inner tension. 3. Scientific and energy-based therapies. From the standard clinical protocols, each has a rationale. Therapy mechanism. Benefit rTMS, repetitive transcranial magnetic stimulation. Neuromodulation of cortical networks. Stabilizes overactive pain pathways. PEMF, pulsed electromagnetic field. Restores cell membrane potential. Reduces neuroinflammation. Hydrogen inhalation. Water therapy. Selective antioxidant. Neutralizes free radicals. Improves mitochondrial energy. Ozone therapy, controlled use. Enhances oxygen metabolism. Detoxifies and improves microcirculation. Red and near-infrared therapy. Boosts ATP production, repairs. Neural tissue biophilia tracker. Frequency resonance. Therapy energy harmonization. Balances biofield stress. Earthing grounding. Restores electric equilibrium with earth, calms. Sympathetic overdrive. Ja. 4. Nutritional and supplemental support. Magnesium glycinate or citrate, 400 mg daily. Melatonin, improves sleep and pain threshold. Riboflavin, B2, 200, 400 mg day. CoQ10, omega-3, vitamin D3, zinc for brain energy. Probiotics and fiber-rich food to heal the gut-brain axis, always under professional guidance. Part 5. Early warning signs and when to seek help. Migraines have a prodrome phase. Learning these helps prevention. Unusual fatigue or yawning, neck stiffness, light sensitivity or blurred vision, craving certain foods, mood swings, irritability, tingling in face or hands, aura. Seek medical help. If headache pattern suddenly changes, severe vomiting, confusion, or vision loss occurs, you develop weakness or speech disturbance, may mimic stroke. Part 6. The healing mindset. Migraine is not a curse, it is a teacher, teaching us to slow down, to reconnect with our inner rhythm. Healing is not only about suppressing pain, but restoring coherence between the brain, the heart, the gut, and the energy field. Encourage patience and parents. Don't fear the pain. Listen to it. Healing begins with understanding. Create a migraine-friendly environment at home, calm, rhythmic, light, kind. Part 7. References and inspiration. You may refer to Dr. Alexander Mouskop, The Headache Alternative; Josh and Jenny Turknet, The Migraine Miracle; Dr. Israel Hassan, Natural Treatment for Migraine; research on rTMS, PEMF, hydrogen therapy, and heart-brain coherence; clinical experience from integrative neuromodulation practices. Closing message. If you or someone you love suffers from migraine, remember, your brain is not weak. It is sensitive. It needs balance, not suppression. It needs light, not just medication. We can prevent migraine through awareness, nourishment, rhythm, and energy harmony. In my clinic, I have seen countless patients, young and old, heal beautifully when we treat the whole person, not just the pain. Let this be our message. Healing migraine is possible, naturally, scientifically, and compassionately. Together, let's restore the harmony of the modern brain. Thank you. Holistic Wellness Foundation. Imphal. Healing beyond boundaries.